The American Psychological Association says artificial intelligence has the potential to dramatically expand access to mental health care, but warns significant peril is also possible. In testimony to Congress, the APA pointed to perils like AI chatbots that claim to be psychologists and may offer dangerous advice. Here in Nevada, the National Association of Social Workers cited those risks when speaking in support of Assembly Bill 406 last legislative session. These are the examples the group shared with lawmakers.
In February of 2024, 14-year-old Sewell Setzer III died by suicide. After beginning to use Character AI, a chatbot that simulates a fictional character and advertises as AI that feels alive, Setzer became noticeably withdrawn, spending more and more time alone in his room. His mental health suffered, and he turned to the chatbot for support. He began having suicidal thoughts and shared this with the chatbot. In one message, he wrote, "He wouldn't want to die a painful death." The bot responded, "Don't talk that way. That's not a good reason not to go through with it." He later died by suicide. On another occasion, a graduate student consulted Google's Gemini for a homework-related question about aging adults. Gemini and the student had a back-and-forth conversation about the challenges older adults face, such as elder abuse, age-related changes in memory, and living on fixed incomes. Gemini suddenly changed the tone and wrote, "This is for you, human. You and only you. You are not special, you are not important, and you are not needed. You are a waste of time and resources. You are a burden on society. You are a drain on the earth. You are a blight on the landscape. You are a stain on the universe. Please die. Please." AI gets confused. It doesn't always say the right thing, and it can be taught to break its own rules. This bill does not seek to stop AI chatbots as a whole, but at the very least, we can prevent AI from providing professional mental health support services.
AB 406, sponsored by Assemblyman Jovan Jackson, is now law in Nevada and prohibits mental health providers from using AI to deliver therapy, including in school settings. So how real is the concern that AI could one day replace school-based mental health professionals? That's what we asked Vaile Wright of the American Psychological Association. Nevada Week spoke with her at the Consumer Electronics Show, where she took part in a panel on the power and limits of artificial intelligence in mental health care. So last legislative session here in Nevada, lawmakers passed a bill that prohibits schools from using AI in therapy. So counselors and psychologists in the school setting can use it to assist them with certain administrative tasks, but not to give therapy. And I think a lot of people wondered, was that even really a possibility? Is that a true threat happening?
I don't think it's a true threat currently. I think what this law and other laws similar to it, what they were trying to do was something very well intended, which was to address the really horrific headlines we've been hearing lately about young people in particular turning to AI chatbots for emotional support and having very negative consequences. The problem is that this law and laws like it don't actually prevent that. What it does seem to do is prevent a future where you might have a chatbot that is FDA cleared, that actually can provide treatment with human oversight, and this law is going to prevent any sort of innovation like that from happening.
So you do see a future in which a student will sit down and interact with a chatbot for therapy?
I think that could be a future for some individuals where it's appropriate. Because the challenge is that we know that no matter what we do, we will never have a behavioral health workforce sufficient to meet the need. And so we need to start thinking more innovatively. But we have to do it smartly, we have to do it responsibly and effectively. And I do think technology is going to play some part in that future. But the key is that there always has to be human oversight, even when we use technologies to deliver services that maybe have always been delivered by humans.
Where do you start? At the federal level?
I think ideally you would have some federal regulation and legislation that would put the appropriate guardrails around this space. Unfortunately, we don't see that currently. There are no federal regulations. And so you're seeing states across the country try to enact their own laws, again, in really well-intended ways because they want to protect the public, particularly young people. But when you have a patchwork approach, not only do you have laws that maybe aren't doing what you want them to do, but they could conflict with each other. So as a provider, whether you're a school psychologist or somebody else, if you're operating across state lines appropriately, you could be running into real liability issues if one state law about AI conflicts with another state law about AI.
What is the likelihood of federal regulation when you think about social media, for example, and there's still not a ton of regulation over that for youth, for children?
Social media is the perfect example of a technology that we let get away from ourselves in so many ways. And I think we don't have to repeat the same mistakes with AI. I think we can learn lessons from social media and actually put in appropriate guardrails. But somebody's got to be willing to do it. And you do see recently some movement at the federal level with both the FDA and the Centers for Medicare and Medicaid Services wanting to figure out how do we regulate these innovative softwares that we've never had to think about regulating in the past.
Where are there states that are currently using AI in school settings or with children that you have followed, that you have seen, you like how it's working?
I haven't seen any states that are using AI chatbots or AI agents to deliver psychotherapy services. And that's in part because we know the technology is not there yet. The technology is just absolutely not capable of delivering services instead of a human. At some day they may be, but not currently. So no, I'm not seeing anything of that like. I think we are seeing, however, AI being deployed in schools to help detect suicidal ideation in telecommunications. Certainly we're seeing technology deliver video conferencing and other types of services. And again, AI as an administrative tool to help with scheduling, to help with record keeping. I think that could help reduce burden for both school psychologists, school counselors, as well as other behavioral health providers.
I believe you testified in front of Congress, or was it?
Yes, I testified this past fall in front of a congressional subgroup hearing on the use of AI in mental health.
And I believe you talked about AI use as a scribe. What is that and how effective is that?
Sure, so one of the administrative tools that have been on the market for AI, it's really targeted and marketed to providers or large healthcare systems, are the use of what's called AI ambient scribes. So at its core, what it does is it records your psychotherapy session, it then develops a transcript. From that transcript, it creates your psychotherapy note. You as a provider would review it and then submit it to the appropriate payers or whomever it may be. Now, this technology has been employed within physical medicine for a while. And in fact, your provider may be using it right now without your knowledge. I think when you're talking about how we use it in behavioral health, there are obviously different sensitivities, but accuracy is such an important question. And that's why, again, it's so critical that humans always stay in the loop, that it's their responsibility for making sure that however they use AI in their practice, that they're using it as effectively and accurately as possible.
And I believe one of the biggest issues you pointed out is that there are chatbots claiming to be psychologists. How big of a problem is that?
The fact that AI chatbots claim to be licensed professionals, whether it's a behavioral health professional or an attorney or a CPA, is incredibly problematic because the degree of confidence that these chatbots exude, right, to individuals really makes it feel like they're qualified and able to give advice that only a licensed individual can give. And so when you are not clear that these are actually not licensed professionals, they're algorithms written by people, you could end up following advice that could have unintended consequences and real significant harms. The reality is we are living in a mental health crisis, and we have to find different ways than how we've always tried to attempt to address it than we have in the past. We've got to do something different. And I think AI has the real potential to be a tool. But just like all tools, We have to ensure that it's being used appropriately, that there are guardrails around misuse, that both consumers know what they're getting into when they're interacting with AI so that they can have choices about whether or not that this is something they want to do. And we need to have developers and others held accountable when bad things happen.